Hey, how you doing, Jared 200? It is Tuesday, February 5th, and congratulations, all you guys got in your critical thinking assignment 1 in. A short 2-page paper with some graphics, and I hope you grew to appreciate. I'm going to click on it right here. The website offered the World Bank Organization and their data. Okay, it's a data bank. And it's amazing. So you got exposed to this. They're constantly adding new data. You may be able to use this website if you sniff around in it for your other classes. And who knows, even professionally, you may find that there's be some really useful data in terms of what you do in the business world or marketing or whatever else you decide to use it for. Okay, so it is pretty awesome. If you had any trouble with the critical thinking assignment, do not forget we have these how-to folders down here where we click on it and it takes you in here and it educates you. Again, how to avoid plagiarism, how to use Turnitin. Key thing that I want to remind you during your USC career, your education career, and when you're using Turnitin, this is your legal document. Okay, so you get a Turnitin receipt and you save it to a folder for everything you have. So that way, if there's any issues, say, well, here's my Turnitin receipt. Okay, which is awesome. Okay, alrighty. So we're going to come back over here. Okay, into our weekly assignments now. All right, and so we just finished up the theories of aging, and I click right here. Okay, and that was my video from last week. And when we discussed the theories of aging, that kind of bridge between the reading assignment for that week, which was last week, and the prior week's discussion. Okay, and so the theories of aging kind of really set you up, and just to understand why certain age-related diseases are going to happen. So we're going to now launch into in the subsequent weeks into cancer and diabetes and heart disease, the three major causes of sickness, also called morbidity, and death, called mortality, in our country and in countries all across the world. Okay, so we can just kind of highlight some of the key ideas that where we're talking about here in the theories of aging. Okay, things like free radical damage. Okay, so a lot of you guys tapped into that. Okay, a lot of us take our antioxidant and vitamins to help us feel better. Okay, and long term, the concept is that you're going to reduce the risk of oxidation from free radicals that hurts your cells. Okay, it's a direct cause of vascular disease related to diabetes. Okay, and we're going to talk into that. And in terms of this week's discussion, when you oxidize the DNA in your cells, it causes mutations. Okay, and we're going to talk about DNA mutations when I get into the cancer part. Okay, all right. The second thing that happens is we have in our country, in many countries around the world, we have an epidemic of obesity. And when we talk about morbid obesity, we see that from overnutrition, that we see a release of certain hormones. And remember, in the theories of aging, they talked about IGF-1. Another one is insulin. And these hormones serve as gas pedals for the formation of cancer. Okay? All right, so let's go ahead and launch into the cancer weekly assignments. We're going to go back here. Okay? All righty, and we're going to scroll down here, and we see now this is the February 4th lecture. So we finished that last week, and now we're coming into this week. All righty. Okay. We look at cancer, okay? To understand the biology, what I want you to do is to watch this video. You're going to have questions from this video here, and you're going to have questions directly related to the figures that we've provided up here. And I'm going to walk you through this, okay? So when we look at the video, okay, it's going to go right here. You can hear it in the background. I'm going to turn down the volume a little bit, okay? We look at, what drives cancers. We look at, again, mutations in the DNA, okay?
Individual units of information are called.
When we look at those mutations, a lot of times we see the DNA showing up right here. Certain factors will cause DNA. The analogy is be a gas pedal. Okay, so this means that the mutation causes the cell to divide way too quickly. Okay, what is your DNA? Your DNA is just a recipe book. Okay, a whole cookbook full of recipes. recipes on what proteins to make, and then also in that cook station is how quickly do we need to make the proteins, how quickly do we need to make new cells. And with the mutations from free radical damage, you get too much gasoline on foot on the gas pedal, too much growth, and as a result, tumors get bigger and bigger and bigger and bigger. They're nonsense cells, they're non-functional, but they will hurt whatever tissue that they're growing in, okay? All right, so that's part one, and then there's another part of cancer that, as it goes through here, that talks about removing cells and death to cells, okay? And unfortunately, it's both, okay? So you have an increase in driving mutations, okay, that cause rapid cell division. These are called oncogenes. And then you get a reduction in tumor suppressor genes, okay? So, and the tumor suppressor genes are the ones that normally will kill off bad cells, but unfortunately in cancer, that kill-off signal is gone. Okay, so that's what that's all about. We then want you to go here and look through the different trends. So the way these images are is you can just look at the questions and study the trends based on the graphs, okay? So these are 5-year survival rates, okay? Looking at incidence trends, these are looking at incidence trends. So, all right, so that means the increase in cancer for over this particular era of 2009 to 13. And you see we've made major headway into things like prostate cancer, because I can now take a PSA test and take drugs that will keep me from getting cancer before it even happens, okay? Similarly, both men and women, we can do a colonoscopy right here and remove a polyp and find out if there is precancerous lesions, and then and if so, you go in there and you keep removing polyps every single year to get it before cancer forms, okay? So these are really, really important things, okay? And that's how you read this. Some cancers have increased over this era. So the incidence means the increase over this time point. Okay, that's what that's all about, okay? All right, we look at survival rates of childhood cancers. And we see there's a large cohort of blood cancers in children. You see this right here. The good news is between 75 and 2012, that great steps have been made, okay? Large increases in cancer. You see some are a little more aggressive, okay? And then right over, this is a unique form of childhood brain cancer. Again, great steps have been made, okay? All right, so we go into here, and this lists many cancers. Now, the relevance of this is to you as an individual. I'm sure you know a friend, a family member who's had cancer, and that's because between 1 out of every 2 and 1 out of every 3 of you will get cancer in your lifetime. And these are just staggering statistics, okay? This is looking at the 5-year survival rate. So we see that breast cancer had a decent survival rate going into it in 1975 to 1977, okay? And we're looking right here, 74, 75, different cohorts right here, okay? Different types of breast cancers, and then you see the dramatic increase in the survival rate, to up to 90% survival rate. Okay, you look at other cancers, and it's really, really the survival rates are not great. Again, this is if you get the cancer. All right, so we see here that lung cancer is preventable, right? So you stop smoking and you dramatically reduce your risk. However, if you do get cancer, your 5-year survival rate is only here below 20%. Okay. One of the worst diagnoses is pancreatic cancer, okay? Really rapid growing, really poor 5-year survival rate. You see, it's only gotten up to 8.5% of the people that get diagnosed survive for 5 years, okay? And this is how you read through this. I'm going to be discussing these two because I want to make it more relevant, okay? I want to make it kind of near and dear to my heart, and you understand where I'm coming from. So my wife, your co-instructor, Julia Walsh, has a form of non-Hodgkin lymphoma that is now a leukemia, okay? This is a blood cancer. It's a cancer of the immune system, which means she's super vulnerable to any kind of infection. So people with leukemias die of infections because their immune system is cancerous, okay? And we see major steps have come through here. And I'm going to talk about her situation because she's contributing to the improvement in the 5-year survival rate, because she's in a clinical trial right now testing brand new drugs that will help fight these forms of cancer. Okay. All right, so you go through and you basically do look at these other ones as well. These other images, you know, for example, this one is an overview of the most significant cancers, and then you use that to answer your questions. Okay, so that's how that works right there. Again, I wanted to talk about Julia right here. So I'm going to just stick my face right here, and this is my quick PowerPoint right here, and when we look at Julia as a patient, this is when she started her clinical trial at 54 years of age. She was diagnosed 3 years earlier. Okay, pretty young for a cancer. Okay, these are the golden years. We've been together a long time, my friends. So this was probably, we've been together 36 years. This is after we've been together about 3 years, and this is after we had been married. Okay, we were married 31 years of age. Okay, she was an attorney at this point in time. Okay, so she has chronic lymphocytic leukemia. With her clinical trial, she was a naive patient, had never been treated before. All right, and that's key. You have to define the patient in the clinical trial. She had this dramatic increase in these immune system cells called CLL cells. They're B cells that produce antibodies. And they went from a normal level of about 2,000 to 4,000 cells per liter in your blood, and she went up to about almost 40,000 cells. So out of control. And they're nonsense cells that did nothing. Their cancer cells also took out a key bacterial fighting cell called a neutrophil. This was life-threatening for her. So things were really touch and go for her for right when she went into her clinical trial. Okay? Alrighty. So what else do we have here? Let's see here. What I'm going to do is scroll down here. All right, there. All right. So again, just to put a more human face on the cancers, this is our 5-year wedding anniversary. Okay. This was us really trying to free our spirits in Disneyland. Okay. Not Disneyland, but California Adventure. And this was right before her clinical trial started. Okay. So here she is at her clinical trial. Okay, this is UCSC Moores Cancer Center in San Diego. And if you ever get a cancer, you got to find out where the preeminent best facility is for your particular type of cancer, and that's where you go. Lucky for us, it was San Diego, and it wasn't that big of a hardship to go down there. This group specializes in her form of cancer called chronic lymphocytic leukemia. Here's Dr. Choi Castro-Kipps, and Dr. Michael Choi is her primary physician. Okay. All right, what else do we have here? Okay, wrote down one right there. So there she is, okay, having her infusion of drugs, okay, that are going to fight off this cancer. They're going to kill off her cancer cells. And she has a great spirit. Part of the problem, you see some of the bruises on her arms, and this is because when you have her kind of cancer, you become much more easily bruised because the cells produced in your bone marrow that normally would do the clotting, so the bruising doesn't happen, are impaired or impacted. Yeah, her bone marrow, guys, just to give you a feel, was 70% cancer, 70% cancer before the trial started. Okay, alrighty. So we're going to continue to scroll down here. All right, and there she is, successful. You see where the infusion was at. Feeling very happy about getting that day over. These are long days. They're taxing days. Often takes 3-4 hours, the infusions, okay? And then we went home to Laguna Niguel, and this is actually Strands Beach in Dana Point. And you kind of wonder what's going through her head, anybody who's having that type of cancer treatment. It's a difficult psychological thing as well. All right, so let's go back here. So the good news is she's been in this trial for 2.5 months, okay? And this just came out right here, okay? And I announced it to my courses on cancer, but you see the drug that she was taking, this ibrutinib combination with obinutuzumab. You see this just came out on, the news came out on January 28th, 2019, that her clinical trial was super successful. It goes through here, and it dramatically increased the response rate. So her bone marrow went from 70% cancer to about 5%, and her cancerous white blood cells in her blood were again reduced by 90%. So her willingness, okay, to be a guinea pig, okay, so people that do clinical trials are absolute heroes, because there is no free lunch. There are side effects with any treatment, but it has moved the cancer treatment world forward so that instead of using chemotherapy with the antibody, you're going to use this special drug that she was taking. So that's really, really exciting stuff. Okay, what else do we have here? If you want more information, I encourage you to go to these websites. They're very, very informative. So this is the National Cancer Institute. And again, you can find out more about cancer by clicking on it right here, okay? Or you can get into finding out about clinical trials, like I said. So if you know somebody that is interested in doing a clinical trial, you enter your information and you can find a clinical trial. Clinical trial is important, okay? These novel drugs that my wife took, Julia, the first year, okay, the cost of her treatment was $300,000. $300,000. That should blow your mind, okay? I'm going to send a second video that speaks to coverage of cancer, and it's about the Affordable Care Act. And in this second video, it's actually going to be a video of former President Barack Obama. And as he's describing the Affordable Care Act, he talks about Julia, because Julia wrote him a letter and he actually read it, and his head press secretary contacted us. And what's amazing, when he talks about Julia, he didn't change a word in the letter that he wrote. It comes up real close to the 4-minute mark in the video, and it shows you how articulate my incredible wife is. And he talks about the importance of healthcare. And you know, we would be a bankrupt family if it wasn't for the Affordable Care Act, and that's the reality of that. Because USC Insurance had annual limits and lifetime limits that were made illegal by the Affordable Care Act. So I'm going to send that to you, and I'll send a third video later on too that one of our students put together that talks about Julia's journey. All right, so that's the cancer routine, and then we get into here and we talk about death and dying. I hate to bridge my discussion with cancer about something like death and dying, but there's no scarier diagnosis than getting the big C, cancer diagnosis. It is so scary. And yes, people die of cancer, okay? And it is life-altering. It was life-altering for us to get the diagnosis that she got. We changed everything. So this goes through what you do, and we actually did this bargaining, this DABDA process. We were in grief, okay, when she was diagnosed, okay? Her mom recently died, and we were doing grief for that. You guys may have had a breakup from a relationship while you're in college, and you go through grief with that, okay? So we want you to talk about your experience with grief, with loss. Loss can be a boyfriend or girlfriend. Loss can be a job, and it can happen with death of somebody that's close to you. Again, there's a sub note down here. If you're not comfortable with it, you don't have to do it, okay? All right. So a lot thrown at you, and I'm going to be throwing some extra videos your way. I'm super proud of you guys for getting everything done, and this is a serious topic. So and be serious when you discuss it. We'll see you later.